I think it's a really, really fascinating agenda, the involvement of patients in patient safety. And what's remarkable is how little it's discussed. But the principal point that I want to make today is if we genuinely believe that we want to make the NHS the safest health system in the world, if we want to make it as meaningful and relevant to the people who use it as possible, and if we want to secure its long-term future, then we need to think very differently about the role of patients in their own health and care and in patient safety. I was going to say as well, if you want to do tweet questions. I'll pick them up at the end. And also, I've done a blog which mainly features the Chazelle's story, which is also hopefully worth a read at my Twitter page at Luke O'Shea1. So there are massive challenges facing the NHS. You all know that, and I don't think anyone in this room would dispute that one of the greatest of those is safety. That's, of course, why we're all here. And the NHS, like all international systems, has to do much better on safety. I think probably like many of you, you will have read many reports over the years. Most recently, I can remember really like it was yesterday reading the Mid-Staff's report, the volumes of patient stories, some of which were too unbelievable to be true, really, but some of which were also, there was this volume of routine disempowerment of patients almost as they walked through the door that was extraordinary, really. And, you know, the things that were just almost in every case that people were not told about their diagnosis. They were discharged without being told what their medication was. The routine stuff seemed to be an endemic. And there are other reports that really stick in my mind, and particularly last year, some of the work on CIPOL for people with learning disabilities. And the report said that 30% of the deaths that they'd looked at were avoidable. I mean, 37%. It's almost incomprehensible. And there have been a number of papers as to why, and one of the most statistically significant factors in those deaths was that carers weren't listened to. So carers weren't listened to, and people died. So all too often in these debates, unfortunately, those people, the carers, the patients, are absent from the debate, and I think that's a real problem. And in conferences like this, Chazelle should be the keynote speaker, not the Secretary of State or the latest sort of doctor with the thinking. And I think you'll see why in a bit, because it's dangerous if we stop listening to patients, because patients are our first line of defence against both those individual safety failures, as we call it, but also those massive institutional safety failures. I mentioned Mid-Staff's, Winterbourne View, and there are many others. So why are patients so important? Well, the evidence is overwhelming on this, and it starts with where patients start. It starts in their homes, because a lot of what we talk about in patient safety isn't about the 24 hours a day, 7 days a week that patients and their carers hold that safety challenge themselves. And if you think about the 15 million people with long-term conditions, you know, almost all of which are managing incredibly complex polypharmacy and making very complex decisions, perhaps extremely badly on a day-to-day basis. The big safety challenge is, of course, not just in the institutions that we're all familiar with, the hospitals, and it's doesn't just lie with the patients. It lies with the professionals. It lies with the patients and what goes on that we don't see behind the closed doors of people's homes. And there's lots of evidence on that. There's also lots of evidence on the role of patients in detection. And again, it's a really obvious point, but patient detection should be at the heart of early warning systems. You know, it's what the whole health system should, in a sense, be built on, because it's the patients that really understand themselves. They understand the changes that are happening, and they understand what's meaningful to themselves. But patients are not necessarily responded to, and the professionals we work with need to encourage and respond to this in a completely different way. And then, of course, patients get into services, and there is, again, a growing body of evidence that when patients enter into services, that they can be disempowered, and they can sometimes not be engaged in their care. And when this happens, you have these extraordinary things. You get over-treatment, you get misdiagnosis of, on a scale that is, again, quite incomprehensible. And I'd like, I'm reflecting on Alan Mulley's work, really, around the negative effects of clinicians when they're unaware of, for example, patients' own preferences about things like treatment options. And he says, I quote, "There are breathtaking gaps between what patients want and what doctors actually think they want." For example, doctors believe 71% of patients with breast cancer rate keeping their breasts as a top priority. But what is the actual figure? Reported by patients, it's 7%. And what we're talking about, really, all of this time is this growing body of understanding that when patients aren't engaged, that we have systematic over-treatment and misdiagnosis. And this isn't just a problem for the NHS, this is the same in probably every system all over the world. So the question, I suppose, that all of you have is also what can be done and what are we doing about it? And that's, of course, this is one of the areas that our team looks at quite carefully. There's good news. There is fantastic evidence that shows that when you build patients' knowledge, skills, their confidence, and confidence is a fragile thing that we need to be incredibly aware of, that wonderful things happen. Medication errors are minimized. Hospital admissions drop because people prevent crises. And that a different kind of partnership emerges in relationship with health professionals. And this can be measured and it can be improved. We're doing work on a measurement of skills, knowledge and confidence called patient activation, which we're trialling in 5 areas with over 100,000 people with a view to it being sort of rolled out next year, about building patients' knowledge, skills and confidence. And simply being aware of where people are and where they're starting from has a dramatic impact on the way that the system and professionals work with patients. I think that's very important. There are, of course, a long range of other programs that we're working on, which I think are very interesting, and many of you will know about things like shared decision-making, and that we're doing work on a related area really around how you involve people in their own care planning in a much more serious way. There are also wonderful initiatives like the one tonight to promote patients as leaders, that the HSJ Awards will follow, in fact, this event this evening. And all of these programs have the same thing at their heart, and that's a move to empower patients and inform them, to see them as skilled partners in their care and not necessarily as just a demand or a statistic or a problem. I was struck by, of all the reports, really Don Berwick's Mid-Stuffs report was really, I thought, the most arresting and simple and interesting on this agenda. And he said, again, I quote, "Patient involvement is crucial to the delivery of appropriate and safe healthcare. The goal of the system should be to achieve a pervasive culture that welcomes authentic patient partnership in their own care." So in conclusion, I think if we really believe that we want the NHS to be safe, if we want it to be meaningful and relevant to the people it serves, if we want it to be a great institution, then we need to involve patients in that new type of partnership. And we need them to be seen as assets. And fundamentally, it should start with listening to patients. So patients can be our first line of defense against safety failure, but they can be so much more, but only if we're prepared to listen to them. Thank you.